Hi, everybody. It's Dr. Christine Anderson. Happy Tuesday. We're here for our episode of Optimal Health, Optimal Life. And in this sort of segment I've been doing, we're talking about spinal health. And we covered spinal health in the neck last week. And today we're going to talk about the upper back. So if you missed last week's episode, I'm going to put all those links in the description so that you can check it out. My general post on posture and then spinal health. And I'll also put the link to the ergonomic post I did, a couple of months ago. I think I did that in March. So if you've got a setup that you've been working from home, it's good, as well as if you have a setup at work. All right, so basically upper back pain and upper back issues go hand in hand with poor posture, right? If you've got your chest is tight and your shoulders are rounded in, you're going to put a lot of stress in your upper back and the shoulder region. People often call this shoulders. This is part of the trapezius muscle here. And that muscle is super important. I'll talk more about the muscles, but it starts up here at the back of the head. It goes out to this part of the shoulder, and then it comes down into the back. So it covers a lot of the back portion of the thoracic spine, which is the main area we're going to be talking about today. And as a result of this rounded back and these tight shoulders, it can make it very difficult to expand your rib cage and restrict your breathing. And this is going to decrease the amount of oxygen you're going to be able to take in. And that's going to affect how each cell functions, getting nutrients, and then also getting rid of waste. And any waste that's left can create irritation in the cell, and that can lead to pain and inflammation, or add on to it if it's already present. So I'll also put a link to an episode I did on optimal breathing with my guest Dustin, and I'll put the link in the description. So a 2015 study in occupational medicine indicated that 1 in 10 men and 1 in 5 women suffer from upper back pain. And I see this a lot in moms that have young children, babies and young children, because again, everything is forward. And I often call it mommy back, because that upper back burden is really great from basically lugging kids and their stuff around all day. So it's no surprise to me that this is more of an issue for women in general. Now, the common causes of upper back pain are going to include the following. Poor posture itself, that generates more issues in the upper back. Chronic muscle overuse patterns, so how you're holding your body, or if you're doing a particular sport or activity, how you're sitting, that type of thing. Acute traumatic injury, so that's a one-time deal that something happens, a car accident or a fall or something like that. Subluxated vertebra, ribs, and other things in the rib cage, like the clavicle. So what I mean by that, and this is a chiropractic term, is that a vertebra, so these are the vertebrae in the thoracic spine, this is the cervical spine in the neck, that vertebra can somewhat go out of place, if you can see that here. Now, these are movable. I can move them a lot because there's no ligaments holding them. But that subluxation is going to affect the spine that's in here. It's hidden. It's well hidden and protected. And here are the nerves that come out that go to the structures in our body that I'll talk about in a second. The ribs are going to articulate right here. These are the transverse processes of the thoracic vertebra, and the ribs come off of there just like this. So they're connected here, but they're not connected very well, because our rib cage has to expand as we take a breath in and then come back in as we exhale. So there has to be a lot of movement there, which means the stability isn't there, which means that those ribs or rib heads can go out of alignment and create pain, and your ribs go all the way up here to the top of your chest. Right up here are the first ribs. So it can create upper back pain and middle back pain. Pinched nerves, same thing can go on there, pinching the nerve coming off between the vertebra. Or sometimes in the case, and I talked a little bit about this with brachial plexus injury in the neck, is that the nerves will come off the neck and go through the chest here. So if you have a tight chest, it can kind of compress here and even pinch the nerve. Osteoarthritis, which is a type of arthritis, we talk in general of like wear and tear. It doesn't necessarily have to be wear and tear, but it's the one that is most common as a result, again, of all the things that have gone on in our life, any falls, any injuries, any accidents, even birth trauma, anything that causes a joint to become stressed and then that joint doesn't have proper motion, then you're going to create a situation where the body's going to try to stabilize that joint and build up bony structures and deteriorate that joint to try to do that, to stabilize it. And that's how you get that sort of osteoarthritis, as opposed to other types of arthritis, another one most commonly being rheumatoid arthritis. And that is more of an inflammatory condition from autoimmunity. So you've got different types of arthritis, but osteoarthritis is the one that most commonly people feel after a certain amount of time goes on. Myofascial pain. So myo meaning muscle, fascia is the connective tissue that covers over all the muscles and the bones and the organs and connects us head to toe. It's a very deep connective tissue. And if you have this type of pain, or if you're having tightness or contractures in the muscles or the fascia, it can affect your posture and then create upper back pain. And then, of course, scoliosis and spinal curves. I'm talking more about the developmental ones, but it can also occur traumatically, meaning developmental as the spine grows. If there are issues with the growth, then the curvature, if we're not getting our sigmoid curvature on the side, so we've got the lordosis in the neck and the low back that develop, then the body will put the curvature this way, right? It needs some sort of curvature for stability. So if you don't get it one way, it's going to put it the other way. If a spine has a curvature, and it's before a child goes through puberty when their growth plates fuse, because these bony vertebra start out as cartilage, and then bone comes in and deposits in there, and there's growth plates. And at about puberty, those growth plates are going to start to fuse, and then completely they're going to fuse in the 20s. But that is going to affect how much change can be made in these curvatures. So once you're beyond those growth plates fusing, I'm not expecting curvatures are going to change, but we can help support the spine. And traumatically, it can happen if someone has osteoporosis. They can break a vertebra and create a defect there, and then the spine is going to try to get itself uprighted in some way. So it's always going to try and make as many adjustments as possible. So most of the time, what I see in my practice as a chiropractor of 30 years, of seeing families, children, pregnant women, adults, is that upper back pain is most often due to inflammation in the muscles and connective tissue in the neck, shoulders, upper back, which often occur along with misalignment of those vertebrae, the ribs, maybe the clavicle, which is the collarbone here. So I check everything as I'm looking around, because pain can be referred. So I don't just go, oh, here's the pain, this is where we're going to work. This is a holistic approach. I talked about text neck and the amount of pressure put on the neck, but it's also in the upper back too, and the upper vertebra. So when you bend your head forward, and especially if you get forward head posture, up in this upper thoracic area, you're going to have about 60 pounds worth of pressure on your upper spine every time you look down at your phone or if you're working on a laptop or whatever. And that's according to research done at the New York Spine Surgery and Rehab Center. So I'm going to, again, include the link to the neck, and you can go back and have a look at that. All right, so we're looking at the spine. The thoracic spine is 12 vertebrae, so we've got 7 in the neck, and we've got 12 here. 5, 4, 3, 2, 1. It's easier to go down and up. 1, 2, 3, 4, 5, 6, 7. So from here to here, this is the thoracic spine right there. 12 vertebrae. As I said, you've got the ribs coming off. You've got the clavicle attached to the sternum, which connects to the ribs, which connect to the thoracic spine. So it's a somewhat more stable part of our spine because of all this connectivity. So our motion is not going to be as free as our neck. Our neck has a lot of motion because it's not fixed in place, right? But we can rotate our thoracic spine, we can bend side to side, we can go forward, we can go back. Those are the major motions for our thoracic spine. And then, of course, our ribs have to move as we breathe in and out. So the main muscles that I'm usually looking at, as I said, are the trapezius, the pec muscles, which connect our chest to the shoulder, our lats, which are in the back, very deep, connected to our shoulder blades, and our rhomboids, which are connected between our shoulder blades. So those are the muscles that are really affected with the upper back motions. So as a chiropractor, what I'm doing is when I adjust patients is that I'm restoring spinal motion, I'm removing nerve interference, I'm enhancing nervous system function, which is the brain connection to the rest of the body. And therefore, as I get things in balance, things moving coordinated and symmetrical and alignment principles happening there, that's going to help reduce the pain and spasm of the muscles. So it's a synergistic action. Now, I just want to briefly go through some of the areas of the nerves that go off of the spine, because that also affects organ function that you might not have thought about. Okay, so the upper part, T1, T2 up here, go out to the heart, and it can also radiate into your arm or even into your chest if you're having issues there. T3 goes to the lungs. T4, and T, by the way, stands for thoracic. You might also see D for dorsal. Sorry about that. T4 through 6 go to the digestive system. T7 goes to the immune system. T9 goes to our adrenal system, which is involved with our stress hormones. So there's a lot going on. And then as you go down to T12, that's where the diaphragm is as well, that big muscle that basically moves our breath in and out. And also right at about that level, you start that entry into our lower digestive system, so you can have issues going on there. Now, just to add even more spice to it, there's something called the parasympathetic system and sympathetic system, which is part of our autonomic system. Sympathetic being the gas pedal, parasympathetic being our brakes. And in the thoracic spine, we have control of our sympathetic system, which is our fight or flight, like what's happening, I need to take control. So this can be useful for me when I'm working on patients. If I find patients are in more of a sympathetic state or parasympathetic, you don't really need to know too much, but it could be important. All right, so we're going to talk about some exercises. And it's really hard to do in this format because on my computer, I have a very limited space. So what I try to do is after this, I'm going to post exercises that I will film on my phone, and then I'll post them to YouTube. So if you subscribe, then you're going to be able to be notified when I put these videos on my channel. All right. And that way you won't have to watch a whole segment to get to the exercise. They'll be separated. So a couple of these I wanted to do so that you could just sit in your chair, right? So if you're at work and you're just needing to take a little break, so I can actually put this a little lower so you can see I'm in a chair. And what you can do is a chair rotation. So you can just turn, this is just a cupping, sorry about that. You can just turn your whole body to the side and rotate your body and hold onto the chair back, keeping the lower part of your body facing forward. So you can get a nice rotation of your upper thoracic spine there. Another one that you can do right in your chair, or you can stand up and do it, is just a chair stretch. So you can interlace your hands and you can just stretch back, or you can stand up and do the same thing. You can bring your arms out to the side and the same thing, just lean back over your chair. And that's going to open up the front part of your chest and release some of the stress and tension that tends to build up there. There's another really great one that you can do at a counter or maybe a file cabinet. And basically, you're just going to form your body into an L. You put your hands on the counter, you step back until your body is in an L position. And that's one I'm going to demonstrate for you in a further post. Pec stretches can be done, and that's that muscle right here, can be done in a door frame. So if you pretend like there's a door frame right here, I can put my arms out and lean into the door frame. I can put them 45 degrees and lean into the door frame. I can put them straight overhead and lean into the door frame. And you're going to feel the stretch all the way in your upper back. You can clasp your hands behind your back, right? And really open up your chest. That same action, a stretching back, can be done over a ball, over a foam roller, anywhere that you can stretch back over. And I'll go through a whole series of that. I've already talked about stretching out your psoas muscle, and that's your hip flexor. So there already is a post on that. I will put a link. Super important, because that's going to pull everything in the front and in the back too. You can do things like cat-cow, you can do cobra, and those are yoga moves that are going to open up the chest where you have to use your back. Again, I promise you, I will be doing these exercises very, very soon, and I will post them so that you'll have each one. As far as strength goes, so what I tend to see a lot is working too much the front part of the chest and neglecting really what's going on in the back. If you're doing if you're doing push-ups and you're doing wide-based push-ups, most of the time you're using too much of your pec muscles. So I prefer the tricep push-ups because you have to use your back more, and I will go over those. I feel that most people are not doing enough pull-ups, and they're not doing them properly if they are. I really recommend getting a bar for your home so that you can do these whenever, and getting a band that you loop over so it can assist you with your pull-ups so you can do it properly using your lats, your latissimus dorsi. And that is so important so that you don't, again, use the front part, because if you're pulling up and you're pulling from here, you're neglecting your back. You're neglecting the back core. That's kind of opening everything up and using those muscles. So it's really so much harder to do it properly. And this is the problem I see with most people, is that they're using those stronger muscles. So that assist band really helps. Same thing can be done with negative resistance on pull downs using a TheraBand or something like that, where you hook it above you and you can pull down, or you can use some weights with a lot. You don't have to have a lot, but using resistance to pull your lats down. Rows, again, using an exercise band or free weights where you're squeezing your shoulder blades together and bringing your shoulders down at the same time. And you can kind of even do that same action in your chair here. If you just squeeze your shoulder blades together, it's called a scapular squeeze, and just kind of hold that for 5 or 10 seconds, depending how well you can do. And repeat that a couple of times a day. And when I'm doing it, I'm sticking my chest out, but you don't want to also stick out your lower belly. So I'm going to show this. So even though I'm sticking out this, I want to engage my lower core so that all the stretch comes in the upper back. All the work comes in the upper back. And speaking of core, there's a posture exercise I'm going to put up, and you can do that with or without wall angels, and that will become more self-explanatory, but it's the same sort of action here, like a scapular squeeze against the wall. You can do it on the floor if it's too hard to do at the wall, and then the wall angels, you slide your arms up. Back core also including Superman, keeping your feet on the floor and just lifting your upper body. And then you can also do the bridge. So you're laying on your back, you lift your hips up, hands clasped behind, shoulders back, and again, you're opening up that area. You don't have to lift too high. I am going to do all of those exercises for you. So I've got my homework to do now. Other things that you can do to help with the myofascial aspect is doing massage, deep fascial work with Rolfing, using foam rollers or fascial balls, even tennis balls, something to get in there. You can use things like essential oils, and I have posts for muscle and joint support, and I can put those in the description so you can have a look at that to deal with some of the pain and inflammation that might come with some of these issues. CBD is amazing. I will put the link to that post I did because it really does help with so many things, including what goes on with our spinal health. And the other thing too is an anti-inflammatory diet. So at the beginning of all this, in the beginning of the year, I went through the 7 facets of health and optimal diet and nutrition and that type of thing. And basically, there are foods that are more inflammatory, some more than others. But there are general things like wheat and dairy, which do tend to create more of an inflammatory response in our body, especially the modern day wheat. It's just hybridized and crazy. And then the glyphosate they put on it, I mean, it's crazy. So you do want to take a look at your diet. And if you are eating sugar and a lot of meat and these highly inflammatory foods, you're going to create that inflammation. So you have to watch that too. All this stuff goes together, right? So upper back pain is common. It's usually not a cause for major concern. So as a doctor of chiropractic, when patients come in, I take a thorough history, I do a comprehensive exam, because I need to know what is the cause going on with that patient. It can be so many things. And then I'll determine a proper course of treatment, including adjustment, some body work, some exercises. So possibly a lifestyle changes, right, with inflammation. So it's a whole body approach, not just I'm working on that area. Now, if you are going back after I post these exercises, and you're trying the exercises and stretches and any other self-treatment you're doing at home and the pain increases or it doesn't get better, please consult your healthcare provider. Symptoms are a message that something is going on. And for goodness sake, if it's a child with any spinal pain, get them checked out right away, because children generally do not have spinal pain. So that is a huge red flag for them. All right, you guys, if this information has been helpful, please give me a thumbs up and like this video. Share it with your friends and family. I recommend subscribing, as I said, to my channel so you'll be notified when I post these videos that I'm promising you, and I will deliver. And then you will know when I post them. And then you can start doing these at home and let me know how it goes. So here's to having a great week of optimal health and living your optimal life. Bye.